Have you ever gone to bed hoping for a full night's rest and woken up stiff, sore, or still exhausted? After 60, sleep can stop restoring us the way it used to. The good news is that tiny changes in how you lie down at night often produce big improvements in pain, breathing, reflux, and even daytime clarity. Today I'll explain the best sleeping positions for people over 60, why they work, and how to make them practical for your own bed. These are simple, doctor-approved adjustments you can try tonight. Point 1. Back sleeping with knee support. Ideal for the spine. Sleeping on your back with a small pillow under your knees is often the gentlest position for the spine. It keeps the natural curve of the lower back relaxed and reduces pressure on discs and nerves. Margaret, 73, suffered from lower back stiffness every morning. Her doctor suggested she lie on her back with a flat pillow under her head and a soft pillow under her knees. Within a week, she noticed less morning pain and needed fewer stretches to move comfortably. How to do it? Use a medium firm pillow under your knees, not too high, just enough to slightly bend the hips. A flat head pillow that supports the neck, not a big mound, helps keep the airway open. This position is especially helpful for people with general lower back pain and those recovering from some spine procedures, unless your surgeon advised otherwise. Point 2. Side sleeping, with a pillow between the knees, best for joints and balance. Side sleeping, particularly with a pillow between the knees, is excellent for hip and knee comfort. It keeps the pelvis aligned, prevents twisting of the lower back, and reduces pressure on arthritic joints. George, 68, started waking with hip pain after years of sleeping on his stomach. Switching to left side sleep and placing a firm pillow between his knees relieved the pain within a few weeks and made getting out of bed easier. How to do it? Choose a supportive pillow between your knees, firm enough to keep legs separated but soft enough to be comfortable. For extra spinal alignment, place a small lumbar roll near your waist. Side sleeping also reduces snoring for many people and is recommended if you have sleep-disordered breathing, though the exact side, left versus right, may depend on other medical issues discussed below. Point 3. The left side advantage, digestion, reflux, and possible brain benefits. Sleeping on the left side can reduce acid reflux and heartburn because of how the stomach sits. For older adults with GERD or nighttime indigestion, left side positioning often means fewer nighttime awakenings. Some emerging studies suggest side sleeping helps brain clearance during sleep, but the strongest practical effect we see is reduced reflux. Susan, 70, used to wake with a burning sensation and frequent coughs. After moving to the left side and adding a slight head elevation, her reflux symptoms almost disappeared. How to do it? Lie on your left side with a pillow between the knees and a small elevation of the head, about 1 or 2 pillows, to further reduce reflux. If you are on blood-thinning medications or have certain heart conditions, check with your cardiologist about which side is safest for you. Individual medical history matters. Point 4. Head elevation, a simple fix for reflux, congestion, and breathing. For many seniors, raising the head of the bed by a few inches or using inclined wedge pillow transforms sleep. Elevation helps prevent stomach acid from coming up, eases nasal congestion, and can reduce nighttime breathlessness. Tom, 75, who had long struggled with mild sleep apnea symptoms and nightly coughing, found that propping his upper body up by a gentle incline reduced awakenings and left him feeling less tired. How to do it? Use a wedge pillow under the shoulders and upper back or slightly elevate the mattress head. Avoid stacking many pillows under the head alone, which can bend the neck. A 30-degree incline is often enough. Start low and increase gradually until symptoms improve. Point 5. Stomach sleeping, why to avoid it and how to change gently. Sleeping on the stomach used to be popular, but after 60 it commonly increases neck strain and limits deep breathing. It twists the spine and can press the chest, making breathing shallower. If you're a lifelong stomach sleeper, don't panic. Change slowly. Hannah, 69, loved sleeping on her stomach all her life. She transitioned by using a thin pillow under her pelvis, and then gradually introduced side positions with a body pillow to mimic the hug-like feeling she missed. Over months she adapted, and now wakes without neck pain. How to change? Try a gradual plan. First, add a thin pillow under the pelvis to decrease lumbar strain. Then practice side positions with supportive body pillows. Comfort and gradual habit building are the keys. Point 6. Managing snoring and sleep apnea with position and support. Snoring and obstructive sleep apnea become more common with age and can fragment sleep profoundly. Positional therapy, sleeping on your side or elevating the head, decreases a chance of airway collapse. One gentleman in his early 70s reported daytime sleepiness and poor concentration. After trying side sleeping with a wedge pillow and following up with his doctor for a sleep study, he began treatment that dramatically improved his daytime energy. When to see a doctor. If you wake gasping, have loud chronic snoring, daytime sleepiness, or witness pauses in breathing, consult your clinician. Positional changes help many, but medical evaluation may be necessary. A dental device, CPAP, or other therapies may be recommended alongside positional adjustments. Point 7. Pillows, mattress choice, and practical bedroom setup. The best sleeping position depends on what supports you. A mattress that is too soft sags and misaligns the spine. One that's too firm presses on hips and shoulders. For many older adults, a medium firm mattress with zone support, firmer under hips, softer under shoulders, is ideal. Pillows matter. Neck support for back sleepers, a thicker shoulder-cut pillow for side sleepers, and a firm knee pillow for side sleepers make a big difference. Lucy, 72, switched to a mattress with better ergonomic support and added a contour pillow. Her nighttime tossing dropped and mornings became gentler. Tips for bedroom setup. Keep a small nightlight for safe nighttime steps. Ensure the bed height makes standing up easy and remove tripping hazards. Maintain cool, dark, and quiet conditions. They amplify the benefit of a good sleeping position. Transition strategies. How to change your sleep position without losing sleep. Changing sleep habits takes time. Start with short naps in the new position to train your body. Use supportive props like body pillows or rolled towels to hold alignment. Expect a short adjustment period, usually a few nights to a few weeks, and be patient. Gentle stretching in the morning and a consistent bedtime routine help your body accept the new position more readily. If pain increases, stop and reassess with your clinician. When to seek help, red flags and medical checks. If changing your position doesn't improve pain, breathing, or sleep quality after a few weeks, or if you experience new chest pain, unexplained weight loss, severe daytime sleepiness, or falls at night, see your doctor. Unintended sleep problems can signal treatable conditions. Heart problems, sleep apnea, reflux disease, restless legs, or medication side effects. A brief medical review will often identify simple fixes. Conclusion. There is no single perfect sleep posture for everyone after 60, but there are clear, practical positions that reduce pain, improve breathing, and help you wake feeling restored. For most people, side sleeping with thoughtful pillow support or back sleeping with knee elevation gives the best balance of comfort and health. Try small changes this week. Adjust a pillow, try a wedge, or swap to side sleeping for a few nights. Then tell us which adjustment helped you most. Share your story in the comments. Your experience could help another viewer sleep better tonight. If this video helped, please subscribe, and share so we can keep bringing clear, compassionate guidance for aging well. Thank you for watching. Sleep gently and take care of yourself.